Are you looking to quit smokeless tobacco? Nicotine replacement therapy, NRT, might be able to help. NRT comes in various forms such as gum, patches, lozenges, nasal sprays, and inhalers. By providing a low dose of nicotine, NRT products can help reduce cravings and withdrawal symptoms associated with quitting tobacco. The nicotine in NRT products is absorbed through the mouth, nose, or skin and then enters the bloodstream. Once in the bloodstream, nicotine attaches to nicotine receptors in the brain, which can activate the release of dopamine and other chemicals that contribute to the pleasurable effects of tobacco use. By providing a low dose of nicotine, NRT products can help reduce cravings and withdrawal symptoms associated with quitting tobacco. Over time, the dose of NRT can be gradually reduced until the person is no longer using any form of nicotine replacement therapy. NRT products aren't a cure-all for quitting tobacco. They work best when combined with counseling and support as part of a comprehensive quit plan. NRT products are approved for short-term use, usually 8 to 12 weeks. After this, it is recommended to gradually reduce use until it is no longer necessary. Gradually tapering can minimize withdrawal symptoms as the person adjusts to being nicotine-free.